We're live.
Hello, good afternoon, everybody. I'm Tanni Thompson, and I'm chair of UK Active, but I'm also a trustee of the National Academy of Social Prescribing. Now, why is that important to me? Well, I know it's a chance to transform how we get people thinking, not just about physical activity, which is the area that I work in most, but it's a chance to get people to think differently about how they interact with society, how they think about their own health and mental and physical well-being, and how we can encourage everyone to think about it in different ways than we've had before. For me, it's about raising the level of activity. It's about a chance to educate and train. And it's also about the NHS. The last year has been unbelievably difficult, but it was challenging before that anyway. And the reality is it's easier to give someone a prescription for medication and it's quicker than it is to talk to them about what they want to do with their lives and how they want to change what they do. And for me, that comes from a very personal point of view. I started off, I grew up in a very sporty family, but my father decided when I was very young that the only way I would have a healthy life that would give me access to education and a job and to lead an independent life would be to be physically active and to be fit and healthy and strong. And I got diverted into elite sport for a bit. But as I get older, I've kind of been very much reminded how important physical activity is for me as an individual and for everyone else around. And activity is one of those things that's, and I'm very specifically talking about physical activity because that's my sort of where I come from. It's something that we all know is good for us, but it's something that people put off as well. We don't think about it in terms of parliamentary terms. We think about it at some point in the future. We should be more active. And for me, social prescribing is a way to change that conversation with individuals. It's not about having a bit rich for me to say this, Olympic and Paralympic.
So unfortunately, we've just lost Tanni. So anyway, Gareth Presch, founder of the World Health Innovation Summit. And as Tanni was explaining physical activity and the importance of it, and also the link towards social prescribing, we have a host of international experts with us here today. And let us start with a round of introductions. So I'm going to go to Bev Taylor from National Academy of Social Prescribing. Bev, perhaps you could just do a short introduction until we get Tanni back online.
Tanni, so hope Tanni's back. Can you hear me?
Yes, go ahead.
Okay, fab. So I was really enjoying listening to Tanni. Hope we get it back. I'm the operations director for the National Academy for Social Prescribing. I used to work for NHS England, where I supported the development of social prescribing. So I'm really looking forward to talking about it today.
Thanks, Bev. We're getting Tanni back online, but let's go to Tracey. If you could just say a couple of words from your perspective, just an introduction to everyone who's watching.
Hello everyone, I'm Tracey Lines. I'm the National Lead for Physical Activity at NASP, National Academy for Social Prescribing. It's quite a new role, so I'm really looking forward to kind of being involved in that. So great to be here today and talking all about physical activity and social prescribing. And hopefully now we can link back to Tanni and we can hear more from her.
Excellent. Thanks for stepping in there. Tanni, you're back. Wi-Fi signal, modern technology.
Thank you so much. I thought you'd all just got bored of me talking and decided to cut me off. Sorry, I'm back in Parliament this week, and our Wi-Fi is a bit dodgy. Is about the only way that I could say that. I was talking about how important social prescribing is, how I think we can do incredible things with it to change how individuals, actually how we can have a different conversation with the whole of society about how we get people to think.
And we've lost Tanni again. As she said, problems in Parliament with Wi-Fi. Huw Edwards from UK Active, be great to have a short introduction from yourself, and you're very welcome to join this session. I'm really looking forward to getting an insight into how physical activity can support the NHS and the wider value creation in the community.
Thanks, Gareth, and hello, everyone. Huw Edwards, I'm Chief Executive of UK Active. And UK Active is the membership organisation in the UK for the fitness, leisure and wider physical activity sector. We have over 4,000 members across the whole of the UK. Been a very challenging period right now, but also provides tremendous opportunity to align this agenda with our sector and for our members and partners to play the fullest role in the health and well-being of people across the UK. So very excited to be able to contribute on this panel today.
Thanks, Huw. We'll hear more from Huw. Well, we have Tanni's back. Hopefully we can get a stable signal and hear exactly what you have to say. Thanks, Tanni.
Oh my goodness. I have had like 14 months where my signal's been really good. Yeah, I'm going to finish very briefly, just hoping that my signal lasts long enough for me to say a few things more. Obviously, passion, we've got to change the way we think about what we do. We need to think about the way that the health service thinks about what they do. We've got to support them to do that. And the final thing I'm going to say before I get cut off again is just thank you to everyone who's taken the time to be online today to have a conversation about this. UK Active is there to help to do whatever we can.
Perfect time as we just dropped off. Let's go to Warren and just a short introduction before we get into the discussion.
Thanks, Gareth. My name is Warren Smyth. I'm Chief Executive of Gabriac Leisure, which is a charity based in Suffolk, in the UK. It focuses on providing leisure facilities and services to engage people in physical activity. And we run everything from your large multifunctional leisure centre that includes pools, gyms. And also we run an outdoor pursuits programme, which provides mobile services to people to get active in the local environment as well. So real broad brush. And I suppose we're on a bit of a journey with social prescribing. I wouldn't say we're experts in it by any means, but we've certainly started to engage on another level. Fantastic, Warren, and look forward to getting it, delving further into the conversation. Let's go to Brussels. Jean-Guy de Gabriac is the founder of the World Wellness Weekend. Jean-Guy, an introduction, please. Tell us about some of your work you're doing. Mute.
Thank you very much. So happy to join all of you from Brussels. As Gareth said, my name is Jean-Guy de Gabriac. I'm the founder of the World Wellness Weekend, an event that started 4 years ago that turned into a movement. Last year in 109 cities, we did not cancel, we did not postpone, we carried on. As you would say in the UK, carry on, and so we did. And we have about 100 ambassadors around the world, all volunteers helping us. As you would say with the UK Active, to keep people more active more often, and absolutely thrilled to join this conversation, knowing that with the support of over 1,000 venues participating last year, we had about 200 articles, and we hope again in September to reach millions of people to encourage them through healthier lifestyles.
Fantastic. So let's bring in Bev Taylor, who's been really the engine behind social prescribing and starting this movement many years ago in the boardroom of NHS England. Bev, perhaps you could set the scene for us. Tell us how important social prescribing is, and with your colleague Tracey, we want to hear more. We want to learn more about how this can have such an impact and support the health services.
Okay. Can you hear me, Gareth?
We can indeed.
Fab. Okay, so we are learning more all the time about the impact of physical activity on our health and how important it is to be physically active. We all want to be part of something. We all want to be connected. COVID has told us so much about that. And so a few years ago, we realised that there were lots of social prescribing programmes popping up across the country, across England and the UK, and we learned from them, and we worked with lots of senior leaders, and we have lots of social prescribing link workers in primary care now. We reckon there are about 1,500 link workers, but there's enough national investment from the NHS for 4,500 link workers in primary care. And those link workers have got time that clinicians and others don't have. They've got time to really get alongside people who might be struggling to get involved in community stuff. It takes a lot of courage, a lot of confidence to come out of the house and to get involved. Some people need quite a bit of hand-holding to get across the threshold into gyms or whatever. So that's where link workers come in. They start with what matters to the person, and whatever it is, they walk alongside that person, introduce them to community support, and make sure that they're really comfortable. I'm going to give you a gorgeous little example. Somebody with dementia who was really struggling, and his wife was caring for him, and they were not getting out much. He'd been a keen cyclist, but he'd stopped doing it because he was getting lost when he cycled. Could still cycle, but just couldn't do it on his own. So the link worker organised for a cycling club to come and pick him up on a Sunday morning, go for a ride with him. His wife got a break. Everybody much more active, much more happy. That's just one example. There's so many. I'm working with the National Academy for Social Prescribing. It's a pleasure to work with Tanni and to see her briefly earlier. And what we're doing is we're really trying to increase the amount of community activities and support that link workers can connect people to. We've created something called the Thriving Communities Programme that provides learning, it provides funding, and it provides support for community groups and voluntary organisations to work in partnership with other sectors, including the physical activity sector. So we've been really, really privileged to work with Sport England and partners with UK Active. And what we are doing is we're going to be building programs around physical activity over the next few years. So I'm delighted to introduce Tracey Lines, our new National Physical Activity Lead, who has only been in post a few days, and funded by Sport England for the next 3 years. And Tracey's going to be really helping everybody to think about how we can increase physical activity. And one last thing from me, it's not just sports groups, it's not just people who see themselves as active that we're trying to get to. We're trying to go well beyond that to any community group, your knit and natter group, your friends of local parks group, whatever people are doing in their communities. We want every community group to see physical activity as an important part of their work. Tracey.
Thanks, Bev.
Thanks, Bev. So yes, as Bev said, I'm Tracey, and I mentioned earlier, obviously new to role, I think about day 5, so really interesting time working, but obviously been working in social prescribing for quite a long time, so really interesting to be here, so thank you today. I think for me, as some people may have seen today, Sport England published the active lives data, and for the last the first 8 months of COVID, and obviously the impact of the pandemic the scale of it is just disrupted all the great work that all of us have been doing in sport and physical activity for about the last 5 years. Unfortunately, it states in the report, has been lost, and inactivity has risen by 2.6%, which is now about 12 million people. And what social prescribing we're really interested in social prescribing is how we work with those people in those areas of health inequality and those people with those long-term conditions. And also what the report found is, obviously, unfortunately, those people have been really, really affected. So it is a real important time about how we think about how we kind of frame physical activity, how we really embed physical activity in those communities that really need it most, and thinking about how we can kind of really work to help people with their mental well-being, deconditioning that's happened in older people due to the fact that many have had to kind of shield due to the pandemic. How can we really, as lots of organisations, come together and think about how we can really move forward with physical activity, as it's just so important. So we've had that with the pandemic, and the lights coming on in the gyms and things across the country, which is fantastic. But it's also about thinking about those people that are long-term unemployed, living in those communities. How can we help them? How can we help them through their long-term conditions? Because they've been the hardest hit. So really thinking about that's some area that we'll be really focusing on within our work within NASP. But also, it was interesting, I think, that on the 7th of April, NICE guidance came out, really talking about people who suffer from chronic pain, and thinking about the fact that actually we should be much more offering physical and psychological therapies rather than painkillers, and actually really advising in that kind of area. So again, social prescribing and really linking to that is really, really imperatively important. So it's kind of, the evidence is clear that we all know physical activity is really good for us, but it's how we can really help and support those people most that really need it most, and developing, I think now, more really kind of innovative, creative solutions to physical activity that really is embedded within communities, and thinking about how we can really enable people to have a really great quality of life. And that's something within my role that's kind of my challenge, is to think about how we can work and how we can really embed physical activity across that kind of holistic social solution. So we've got really holistic social prescriptions of which physical activity is embedded. So as Bev noted, around thinking about those knit and natter groups, it could be simply about getting people to walk to them, having safer routes, enabling people to feel safe within their community, and thinking about how we can embed things with singing groups, all of those different elements, and working cross-sector. We know from working with link workers, I've worked with Sport England, and we did a study of link workers, and we found that 74% of link workers at the time, this was probably about 5-6 months ago, were saying that physical activity felt that we needed sometimes a bit of a different offer. So we really need to consider that and think about that. We've got some great people out there working in this field, and how we can really, really galvanise it and really link it to social prescribing to develop some really great kind of systems for social prescribing, and the pathways to enable people to get there to feel supported along their journeys. So that's my role, and be looking forward to working with lots of people in the future around that.
Thanks, Tracey. And let's bring in Huw into the conversation, because in terms of championing with UK Active and the physical activity sector, Huw is a real leader in this space. I've actually been privileged to see him on Sky News recently, and definitely championing the sector. So Huw, words of wisdom, and how can UK Active interact and support the NHS, because that's a huge opportunity.
Thanks, Gareth, very much for that introduction, and also to Bev and to Tracey, set that context so well and so comprehensively. From my membership, to be very straight, I think the opportunity here for gyms, pools and leisure centres is huge, and very much a sleeping giant in this space. We are a sector which you'll find in every town and in most high streets across the whole of the country. The numbers, and echoing what Tracey said in terms of the Active Lives survey, which has come out in the UK today, if you look at the numbers just before COVID in March of 2020, fitness and swimming were recording over 17 million weekly people, adults, hitting the target of chief medical officers' activity levels, 150 minutes of moderate exercise a week, dominant outside of probably casual walking, active walking around work. And so this is very much the engine room of activity in the UK. And whilst we've been in a period of great challenge, whilst we've been closed over long periods of the last 12 months, the restrictions ending initially on the 12th of April for individual access, and then being followed on the 17th of May with group exercise. In that first week alone, you saw quite considerable people returning to these facilities because they're built into their behaviour around activity. One major operator alone, achieving 1.2 million visits in 1 week. These are staggering numbers, and staggering numbers about how positive that impact will be on the physical, mental and social well-being of those individuals who have not been able to use these facilities and who are dependent on these facilities for various different reasons. And so the opportunity is huge to do more with our members in this space, number one. Number two, irrespective of that, there has been a huge amount that the sector and the whole of the sector has been doing around improving the health and well-being and playing the almost front line of prevention for the NHS. If you look at the number of cases, preventative cases that the whole sector has played in terms of heart disease, reducing cases by 150,000, type 2 diabetes by 900,000, depression by 375,000 cases, 30 million visits to a GP not required because of the role of sport, recreation, physical activity. That is huge. And so what does that mean in reality? Well, the opportunity is probably twofold. The opportunity is the journey that I will be working with my members on in terms of their evolution into being as inclusive and as accessible as they can be for all their members, from the youngest through to the oldest in society. That's around standards, that's around inclusivity, that's around programs and interventions which will be as inclusive as they possibly can be for all partners. And then it's about working with government and its agencies to provide those strategic partnerships that will have a profound effect. One example is that, the offer that we've been made, to work with NHS England on 100,000 people having access to our facilities over the next year as almost an initial introduction to what our facilities can provide. That is just a small step in what is the real potential here. And if we're able to look at our membership and the role our sector can play and increase participation levels in our facilities by an extra 5 to 10%, that will have a profound impact on the health and well-being of millions of people across this country. And that's a major prize. And so we're very excited about the reforms and the evolution of our sector. And if we can marry that with a real strategic partnership, then the opportunities here could be really profound and really transformative on this agenda around social prescribing.
Thanks, Huw. And let's speak to Warren to give us an insight from the sector's perspective, from those facilities that are that are being used at the moment. Warren, you've heard from Huw there. There's a massive opportunity here. Please give us your thoughts.
Yeah, I suppose there is a huge opportunity here, and we've been on a bit of a journey with social prescribing and broader system working with partners for quite some time. Well, for about 2 years now. Sort of semi-rudely interrupted by the pandemic. It's clearly had a massive impact in terms of people being able to utilise some of our services, but we have adapted and changed some of our models to try and support those. But for me, if an organisation wants to engage, there's a bit of a cultural shift that needs to take place, and Huw talks about that enthusiasm that operators have for that. I think we need to take that to another level and really be open to the conversations that are going on at the moment. We've done that to a point, but the bit I would like to pick up, Bev mentioned you learn something new every day, and actually on our journey, we're not going to say we're experts, because we do learn both from the social prescribers and the clients what the offer may or may not need to be. And there's a mention of a different offer, and I do think it's a different offer that we have to come up with. I think our focus initially has been on a few areas. One is being open to help, and to do that, it's about doing the right thing. And I think the pandemic has taught us more around that. And social prescribing has been working informally during that period, actually, if you look at how communities have come together and supported each other. But the other barriers we remove are simple barriers. So they are providing a base for the social prescribing teams to work from and to meet some of their clients, get them over to the threshold, get those clients to understand physical activity perhaps isn't what the perception is sometimes, and actually making those social prescribers champions and working with them. Also understanding from an individual's point of view, a client's point of view, there are, and I think Bev mentioned it, is that they have certain needs that have to be met first before you can engage them in physical activity. And for us, we don't provide social prescribing directly. We are the support service from a physical activity point of view around it. And we know if someone hasn't got a home, that's a primary reason, that's a primary issue needs to be resolved first before you can get them engaged in physical activity. But by meeting on the site, we both engage with the social prescribers and we work with the clients as well. We also remove the cost barrier. And we make it very easy for the social prescribers to refer clients into us. So our social prescribing teams locally have they can set up an individual's membership. So when that individual attends our facilities, they can come whenever they want. They're just like any other client, actually. And those are most in need. So, for example, 78% of the client base that our social prescribing teams are working with in West Suffolk are unemployed. So we're reaching those most in need. And we, again, sometimes it's not nice to raise those issues in a reception area in a facility. So it's about removing some of those barriers and making it easy for some of our service to be accessible. And then we also provide some sort of distance support, if I'm honest with you. So we will know some of those clients who might need a little bit more support, and we can add that support in a really informal way, in check-in points and so on and so forth. But again, in a non-threatening manner. And we're not, we focus on the individual about what activity they might want to do. So they might want to do health walks. They might want to come to the gym. They might want to come to the pool. They might want to come with their family to a soft play facility. We try and facilitate as much as we can. But I suppose my key message is I think the sector is really opening its eyes to what the opportunity is. And in Suffolk, particularly, our stakeholders and partners in the health system are really engaged. They want a different opportunity to emerge. They certainly want physical activity to be at the heart of that. So it's now time to spend a bit more time in that space and really capitalise on the opportunity that's there.
Amazing example, Warren. Fantastic work. What value you're creating in the community. It's fabulous. I want to just go to Brussels and to Jean-Guy de Gabriac, who's a pioneer in this space, really, from someone who's doing social prescribing on a global perspective, but probably probably hasn't heard much of the terminology of social prescribing, but is the founder of the World Wellness Weekend. Jean-Guy, please give us a flavour of what you've been doing around the world. I mean, we've heard from you at the World Economic Forum and other areas before, but please share with your audience here what exactly you're doing.
Thank you so very much, Gareth. And I'm so pleased to hear you talk about all those numbers related to non-communicable disease, because I don't know about you, but switching on TV, all we hear is about COVID cases, about ICU, about the vaccine rollout. Where have gone the 35 million people who before COVID were dying every year prematurely because of respiratory diseases, diabetes, heart failure, strokes, and of course cancer? These people are still there, and we have more than one pandemic on our hands, and we definitely have sleep, obesity, inactivity, anxiety. So with the World Wellness Weekend, we contribute in a small way, but it's growing. It's really growing. We started in France and Belgium in 2017, grew to 88 countries the year after. Last year, 109 countries. And by the end of this month, I believe that the reach that we have with venues participating, including fitness clubs, and also the fitness areas in hotels that are reopening all across Asia right now, will be reaching 120 countries. There's so much we need to do to encourage adults and especially adolescents who lost maybe the appetite or the urge of meeting each other and practicing together. They need to have what we call a wellness buddy, to have someone they can be accountable for, someone to practice regularly with. Huw was talking about the millions of people that were using fitness clubs and swimming pools. That's absolutely remarkable. I believe there's a pent-up demand of people who want really to participate. So thrilled to see that the National Fitness Day will be on Wednesday, 22nd of September. World Wellness Weekend will be just a few days before, on September 18 and 19 of September. It's always on the third weekend of September, just before the equinox. And recently we were discussing with the European Week of Sports, we were discussing with the European Commission, because we're one of their partners. So many kids and teenagers are, when they're asked what kind of sports they practice, they say, well, football. I love football and I practice football regularly. Really? In which club? No, at home, playing video games with my friends online, competing. So it's scary to see how people really confuse how they can be active sometimes with a computer and how they need to be more active physically. This is, I believe, one of our responsibilities for us to encourage them to feel like heroes, not just participants, heroes. They can be the artisan of their own well-being, and they can be an influence on others. Sure, we can have champions, we can have athletes voice out messages to be more active more often, and we certainly do that. But what about neighbors? What about colleagues at work? What about members of the family? what about people who can just say, I love running. Who would like to come and run with me? I'll start at 9 a.m. In Hyde Park. Who would like to do yoga with me? That will be on Sunday at 11 a.m. I believe there can be more and more wellness enthusiasts. And this is really what we've launched. I believe sometimes high tech can help also people connect on a physical standpoint, because on the map that we have launched on wellmap.org, a website in 16 languages, it's not just venues and fitness clubs that can participate. So far, we have over 1,000 active and participating and showcasing their activities, not waiting for September, but what they will be doing in the coming months. Also, we have wellness enthusiasts signing up. And these are the ones popping up and say, I matter, my practice matter. Would you like to join me? So I could go on and on. I'm French and very passionate, obviously. This is a conversation, but this is how active we are and how thrilled I am to be part of this conversation with you guys.
Fantastic, Jean-Guy. Let me go to Tanni. I have a couple of questions that I'd like to put to Tanni, because Jean-Guy touched on the stress that the health service is currently under, and he's dead right in what he's saying. The NHS has vacancies at the moment, and globally we've got huge problems around elective surgeries, backlogs, social prescribing, physical activity can play a huge role. It's a huge opportunity. Also, I wanted to also get your thoughts around green activities in terms of, climate change and physical activity outside, planting of trees. This is a huge opportunity as well with carbon credits. I'd love to get your thoughts on how do we get policy to change and to move investments into this space, because we are creating enormous value in this space.
Thank you very much. And hopefully my signal's okay now. So, part of it is about inspiring people to think differently about what they do. And I think that's a really important part of it, because legislation is important, but we've got to take hearts and minds of people with as well. And the reality is legislation takes or can take a long time to get through, and it depends on government priorities and what's in the news at the moment. And I think although COVID has been absolutely brutal and awful for so many people, I think it's started making people think differently about their levels of physical activity, because we know the impact it has on people who are overweight or who aren't physically active. So it's a way for us to be incredibly creative. And I think it may be a bit rich coming from me, seeing as my background for 25 years was as an elite athlete, but sport and organised sport is an important part, but it can be a tiny part of it in terms of creativity. So, we've had discussions. So you talk about planting trees, but actually, if you take it down to human or individual level, gardening and doing something really important in your local community has a massive impact on the individual and will get people to think differently. So this is a whole rethink of all of society. And in fact, the more we talk about it, I think it's more of a light bulb moment for individuals to think about what they can do, as well as influencing. There's a huge influence through local councils and local government, as well as the national government. And, in terms of the green agenda, what kind of excites me about this as well is, so many young people I talk to have really strong views on things like global warming. But then you talk to them about what are they going to do on an individual level to change. So it could be walking to school or college or university. It's all those things. I think this is a way through social prescribing. We can tie up lots of really, really important conversations that we haven't necessarily been able to do before. And we've got to make the most of what's in the news at the moment to be able to change people's attitudes.
Absolutely, Tanni. And let's ask Bev, making the most of these opportunities. NHS England has a huge opportunity here to work with the likes of UK Active and broader stakeholders. You've been at the forefront of pushing that agenda. Please give us words of wisdom. How do we do that? How do we show that the value in gardening is there, because you're offsetting, shall we say, long-term conditions like cardiovascular disease?
Okay, I think we've got
lots of different ways that we can do it. Can I make a plug? So we at the National Academy for Social Prescribing, we've just started a thing called Podcast on Prescription. You know, you can get it from any podcast provider that you see, and just download it. The latest one is Professor Muir, who's talking about keeping older people more active. But we've got EastEnders actors. We've got Julia Bradbury and all kinds of people who are being our ambassadors, and we've got to really get that message out to the public, and we've got to find really creative ways of doing that together. We've been talking with the UK Active about how we can release more fitness time, and how the link workers can connect people up through that release of more fitness time. Tracey and the Thriving Communities teams, they're going to be working with local community groups about how can they be more physically active in all kinds of practical ways. And we've got to galvanise whatever funding there is out there in whatever way to really help to fund community groups. So £500 for a community group goes a very, very long way. Sometimes it's only really small bits of money and support that's needed to really bring about a big impact in a local community. One very last thing we can just thinking about football. I'm a big football fan, so whatever your passion is, we can connect people to that. There's some lovely work being done by the likes of West Ham, by Newcastle United, Sunderland, Charlton Athletic. Lots and lots of different football clubs have been working with their link workers and creating community support, particularly in times of COVID. So thank you to everybody that's been doing that. We want to hook more people in.
Huw, from your perspective, listening to Tanni and to Bev, how do we hook more people into this? I mean, because you've mentioned your membership, very, very broad, very diverse, huge reach. What's your message to them? How do we engage in this wave of activity?
Yeah, look, and I think the work that the Bev and the wider team are doing is fantastic to see in terms of the those early partnerships and looking forward to how they mature. I think two real things really. I think from our perspective, we are here to support our sector, go through this period of survival and recovery post COVID, but a key element is also development. And if you look at some of the projects which are coming up the next 12 months from UK Active working with our members, we're going to be introducing a new active standard which is going to provide greater consistency of standards across the whole of the sector, both public and private. And this is really good in terms of providing that level of consumer confidence in facilities, and will provide a mark of standardization which will hopefully become that level of consumer trust. Then you're looking at the work which we're doing around plus 55 audiences, and we've just concluding a major piece of research which is looking at how do we create a longer term relationship with people who are 55 plus within our facilities, which in many ways will be down to workforce development, will be down to product, will be down to timing, be down to incentivization and price. And so that's really important that we then work with our members and partners on that. And in the coming months, we're going to be rolling out in pilot phase, which has been delayed for a year, our Everyone Can project, which is looking at how we have a sustained relationship with disabled people, which is really important in terms of making sure we have that level of inclusivity. So part of that is the journey in which we will go on with our sector. It includes digital transformation as well, and working very closely with our partner Sport England here. The bigger prize, and which will have a bigger impact ultimately, will be how governments, not just in the UK but across the whole of the world, really understand what they've got with the role of physical activity, and how they're going to improve the landscape of regulation, legislation, taxation, investment, which can actually enable and not restrict people to be active. And very interesting to see the early conversations that are taking place within the government and the health agency, the Department of Health, around reward and incentivization for people to be active, which we're having some early conversations with. Now, It is about changing the dial and making sure you're looking at this huge asset that people have in a much better way and getting the most out of it, which hasn't historically happened for generations. And so that is the prize, especially coming out of a health crisis where the only answer is really in our health. How are we going to change the dial and how people look at health in a very different way from government down, really?
I totally agree. Jean-Guy?
Yeah, absolutely. I'd love to jump in for just 1 minute, because Tanni and Bev said two things really important. Tanni talked about inspiring people, and it's definitely about inspiring and empowering, not just with SDG3, which is good health and well-being for all, but also with SDG 17, which is the partnerships for the goal. And partnering with groups is one thing, partnering with cities is another. So many mayors want their cities, now that they're reopening, to be considered as cities that are, should be considered as cities where to live, to work, to play, to visit. So SDG cities and wellness cities. We're partnering with the city of Marseille, for instance, which is the second most populated city in France. 18 thermal cities in France that are usually competing with each other, but on the World Wellness Weekend, they decided to organize each of them an activity around the weekend, but all of them will do something at 11:03, because, and to answer Bev's comment about creative, it's not just about organizing fun activities where people can run, can walk, can hike and bike. It's also adding fun to those 3 letters of SDG. If we can add FUN, fun, it's really important, because we've been hammered with anxiety, hammered with stress, with adrenaline, cortisol, and thrombine, which is the enzyme that is creating blood clots and thrombosis. We need to help people to be active again, breathe with their mask, with a safe distance. Now, apparently in Sweden, they don't say you should be 6 feet apart. They say you should just leave enough space for a young reindeer to be among you. In the Caribbean, they don't see 6 feet apart. They say, please leave room for a young dolphin to be, and in Canada, they talk about 3 geese. So it's about adding fun, adding excitement, so that people can be legally high on endorphins, serotonin, and oxytocin, learning how to learn each other and not just to fear the presence of someone other, because the other could be contaminating you. Actually, let's make enthusiasm contagious, safely contagious.
Absolutely, and physical activity can play a huge role in that, Tracey. From your experience, what you've heard here from NASP, National Academy of Social Prescribing, next steps for you?
Oh gosh, that's a really good question, isn't it? Next steps. Okay, I think for me, it's really about us looking at the whole sector, and that's including, the link workers, all kind of social prescribing services, and looking and understanding one another's needs. What we do know, we know the power of physical activity, we know the power of the football clubs, the brands, all of that, and we are all there. We're all very, very keen. I think the next steps now are for us to look at how we build those great bridges between lots of different sectors and look at how we can do things quite inspiring for people and enable things to be fun, and think about how we can do those interconnections. How can we embed physical activity into the arts? What's the role we can do with that? Listening to Warren, he was saying that, it's about those different offers. Well, what does that look like? How can we do that? But most importantly, how can we work with communities to ensure it's the offer that they really want and it's right for them? And I think really looking at that kind of, dare I say, that co-producing, working in those ways and thinking about how we all here are really keen and really want to do this work, how we can work collectively together, because there is so much power in physical activity. I've seen it from work I've done in the past, and it can really, really change lives. But it's how we inspire those people and how we really take our services and work with them and just build it into everyday living. And also for some, they'll need an intervention. For some people, it could be about getting older people out that have been isolated for the last 12 months, they're lonely, actually getting them along to their local sport activity to just go and spectate and talk to others and connect. For others, it could be going out and walking in the park. It's a myriad of opportunity, and how we do that is really thinking about how we build those bridges and kind of link and lock things together. And that's kind of some of my challenge over the next 3 years to think how we do that, how we can work really innovatively with different sectors, and really be really great to work with the Warrens and think about this differing offer. What can it be? Let's be really excited by it, I suppose.
And that's great timing to bring Warren into the conversation. You gave great examples earlier of the value being created. Warren, you've heard from colleagues about some of their thoughts. What do you think next comes? What from your perspective?
I think it's really interesting. I think there's a need to look beyond the bricks and mortar and the direct activity that people are taking part in, and look at the people that take part. Because if you look in all of our facilities and service we provide, there is a core social support group that emerges. And it doesn't matter whether it's activity taking place outdoors or in our centres, in over 55s, group exercise classes, even in our gyms. There is a natural sort of peer support group that works. And there are some really powerful stories that emerge there that can win hearts and minds. We've got a particular customer who she clearly labels the leisure centre saved her life on the basis that she lost her husband a number of years ago. She was introduced to a particular group that does some low-level physical activity actually and has a cup of tea afterwards. And her view is she created a whole new friendship circle out of that, and it really did help her change her life. So there's some really powerful stories that emerge out of this activity. And I think, so Tracey hit something actually, is sometimes it's the cup of tea that's more powerful than the physical activity. The physical activity becomes a byproduct of associating yourself with some of those support groups, really. So I think it's quite fascinating. The first stage is introducing people in a really soft way into a different form of physical activity sometimes, and just actually watching, merging, just enjoying something actually first. So I think it might take a slightly different approach than trying to force people over a threshold or get them to participate in a particular activity. Very soft. And for all we know, our timetables might be full of coffee mornings in the future with different groups meeting and then participating in an activity. But I think that gives a flavour of perhaps what some of our services might look like.
Brilliant. Thanks for that. And Tanni, we're going to do a round of final thoughts from everyone. And having listened to the conversation and from your perspective, the next 12 months will be crucial. I mean, we're going to try and frame the future of healthcare. We've got a huge opportunity for health to be a massive driver of social change, from a positive perspective, rebuilding after COVID, but also then, tackling climate change. What's your vision for the next 12 months and how do you think it will pan out?
Well, as the world starts opening up, I think how we return to work is really important. There's no doubt that, it's been very stressful and very difficult working from home. But also I've seen people being physically active who haven't been active for a long time before. I've seen so many women riding bikes they've never ridden before. And so I ended up shouting at a few people, telling them to raise their seat height, because actually then they'll have a better experience. They'll want to do it. So I think there's lots of things we can capture in this moment in terms of how we help people return to work and think differently about how they travel and those type of things. But I think we just have to keep talking. So obviously, we're all really passionate about it and we get it and we see the value. But we have to keep pushing those messages so the people who don't understand the value of physical activity start to realise it and don't keep putting it off and don't keep thinking about it. Well, we'll do something in the next Parliament or we'll do something 5 years from now. We have to think, and I think some of it's an economic message in terms of actually this is it's about saving the NHS in the UK and it's about saving money long term. And I think if we can pull all those arguments together, we have a massive opportunity to change what we do.
I totally agree. And let's bring in Tracey. I mean, demonstrating that value, that's going to be a key aspect of the National Academy of Social Prescribing, that evidence base. Next 12 months, from your perspective, where do you see things going?
I think it is very important that there's two sides really. Obviously, we need to, as Tanni said, it's kind of a investor save kind of in looking at social prescribing. We can do so much more. But there is that whole piece around educating people so that people do understand the evidence. There is so much out there. We've got lots of, different people that will be able to help us with that. We're pulling together through NASP, lots of different, trying to make the evidence easy to understand, because, you can get the evidence report and read it and it can be quite complex. So we're looking at how to do that, enabling people to understand the evidence more in all different areas around social prescribing. So that's really important. But also I think it is important to show the journey that people have been on, and actually for those people that are providing those more interventions, actually giving those stories like Warren did, really those case studies, understanding and showing the change. And there is things where you can start to, I've definitely worked in areas where we've shown how we've moved people from different prescriptive drugs off those drugs and the savings that those make. And that's, that is important. But cometh with that comes actually supporting organisations to understand how to collect the data in the right way, etc. So there's a big piece of work there that we'll be looking at going forward.
And Huw, you'll probably come into the equation here. You've got an amazing research and development team where you're doing a lot of R&D in this sector, demonstrating that huge value that can be created. From your perspective, the next 12 months, I know people have suffered over the last 12 months, but the fitness industry, the fitness sector can be a real beacon of hope and life.
Absolutely, and I think the next 12 months are going to be about that period right now where we're looking at the survival and recovery of the sector coming out of the period. But the big prize here is development and the sector playing its fullest role in the health and well-being of the nation and its renewal. Now, at the moment, I said from the start, we are a sleeping giant. There is so much more that could be leveraged from partnering with our sector by government and its agencies in a way which hasn't been done before. And some of that's on us in terms of how we reform and develop and improve our inclusivity, which we're on that journey. But then it comes down to where the partnerships can be. And I think, it's a real opportunity to work with us in a way which haven't happened before, which will have a profound impact on the health and well-being of millions across the country.
And Warren, final thoughts from you. I mean, you've heard Huw there talk about how do we engage. You're a great example. I think the work you're doing in Suffolk, 12 months down the line, what's your plans? What do you see happening?
I think a more open dialogue, and that with enthusiasm, I think it's really interesting. Stakeholders are grasping the opportunity and understanding the benefits of physical activity, and continuing that conversation is really, really important. And we're winning lots of champions in that space that are really starting to support the work we're doing. So I think that dialogue and an investment of time is really important to make things happen, if I'm honest with you. The other thing is a huge opportunity. Just strip away some of the people factors, but our sector has infrastructure and resource in terms of people and buildings right at the heart of their communities. And there's a real opportunity to engage in that. And I'd urge anyone on this call, actually speak to your local operators around what that opportunity might be. And then you will slowly but surely start to see your communities become more active, more engaged locally in the services they provide, but also connected on a slightly different level. We talked about some of our customers returning at the moment are really grateful. And that's a bit of a weird saying for me, that people are paying for a service, but they're unbelievably grateful that our facilities are open and serving their local populations. So I think it's a different relationship that I'd like to see emerge in the next 12 months between the customers that we serve, customers and communities we serve, actually.
And Bev, different relationships, building new relationships, that's exactly what NASP is there to do. Please tell us the next 12 months from your perspective.
Absolutely. So we are here in solidarity to work with everybody and to encourage some fantastic community partnerships. So we're going to be building the evidence base, as Tracey says. We're going to be supporting ambassadors, champions, wherever we can find people who are committed to increasing physical activity, supporting social prescribing. We will support them to work together with others, whether that's locally, regionally, nationally, internationally. And we need to raise the profile of social prescribing with the public. We need people to just find their passion and have the courage to go with it. So let's just get on with it and see where we end up.
Absolutely, and let's go to some passionate people in Brussels. Jean-Guy, final words from yourself, raising that profile. The sector that you're involved in, you have a huge opportunity here to raise that bar. Also working with, the SDG cities and other areas, there's a massive opportunity in this space, isn't there?
Absolutely, and really, I would like to salute your efforts, your consistency, Gareth. We've known each other for years now, and from meeting an ambassador in Brussels, talking in Davos with the think tank, now on your way to working with the G20. It's just remarkable that what has been shared around this conversation and what you're doing also with UN Habitats. I believe in the coming months, weeks, days, as people reopen, they should reawaken to the fact that their health matters, but their example matters. For families, for friends, for colleagues, they should be more active, but they should encourage more people also to get active with them. They should set objectives. They should measure their progress. They should salute and celebrate their achievements. And I believe each week, each weekend, if someone does something for sleeping more, eating better, being more active, being more mindful, use a piggy bank, use a sock, use a glass, use a cup, wherever you can put in a coin or a banknote. Some people, like silent collections, but the idea is get some money and then donate it to a local charity, donate it to an NGO, so that you can be the hero of your own health, of your own life, and you can be the hero of somebody else's life who absolutely needs so much more. So if not now, when? And if not you, who?
Fantastic, Jean-Guy. I'm just delighted that everyone could join us today. And I just want to stop for a couple of minutes and just talk about the whys and how important this work really is. From a healthcare perspective, we face huge challenges, as the general population would be aware, but globally, 18 million is the staff shortfall by 2030. And so we need to look at new ways of creating new and meaningful jobs. And the fitness sector, physical activity, is a new way of looking at that for investments. And just from Jean-Guy mentioned our work with the G20, and we have the opportunity to put social prescribing on the map next month in Berlin at the Global Solutions, and then the T20 in Italy later this year, and our work with UN Habitat on the SDG cities with UNGSII Foundation. And what we're clearly demonstrating, which we have through the WIS platform, is £1 invested, 36 back in societal impact. Now, that's a huge number when you look at the sector is worth $12 trillion. And when we look at how do we leverage investments, there are investments out there, and key players like the Fates are looking at how do we stimulate and grow economies from a purposeful perspective. Physical activity is a huge area of opportunity. So I hope by working together, these connections that we're making, that we can leverage that wider support. Tanni's support, Huw, Warren, the examples, Bev, Tracey, all of us working together, we can achieve our goal, which is to leave no one behind by 2030. Final words from me, just to say our next webinar is on the arts, and we'll be showcasing how that can impact from a social prescribing perspective on the 7th of May. And I hope you've enjoyed the conversation. You can pick up all these webinars on our website and through the Global Social Prescribing Alliance. And I'll just say thanks to everyone who's chipped in today, and we've really enjoyed this discussion. So from me and our speakers, thank you very much, and we'll sign out. So thanks, everyone.